Once again, hearty welcome to the special webinar hosted by the National Neonatology Forum today on the eve of the World Health Day. Three days ago, on the eve of the World Health Day, National Neonatology Forum launched a project called Habilitation, aimed at primary and secondary prevention in newborn care. And Habilitation project aims to address the very issues that the World Health Organization has highlighted as a theme of this year's World Health Day. We need to start from the very, very beginnings, which means we need to target adolescent girls who are likely to conceive. And from the time of conception, we need to take active role because shaping the future of these babies is not entirely in our hands. We need the whole team. The fetal programming that the fetus and the subsequent newborn undergoes is mainly dependent on the mother's health. So we need to start there. And then, of course, the first 1,000 days of optimal growth, including the most important part, nutrition. In addition to this fetal programming and first 1,000 days of life care, for the high-risk unfortunate babies, we need to also look at their secondary prevention. The primary prevention, of course, is the way to go, but secondary prevention is equally important. The screening of all babies to detect problems as early and then habilitate them instead of rehabilitating them subsequently. And of course, for the unfortunate one, developmentally supporting care. So the whole, we have a battery of things to do. And this is what we are going to highlight today in our webinar. In the coming days, NNF, along with all other like-minded organizations, aims to address these issues. Friends, on this occasion of World Health Day, let us all resolve to empower and transform the lives of all those whom we look after. I wish a happy and World Health Day to all of you as well. I have great pleasure in opening this webinar and then inviting the guests. May I request Amit to introduce the speakers and proceed. Let us have an active discussion and look at the problem that is actually behind us, the larger picture, not just a simple the case that we come across. The larger picture is what WHO has rightly highlighted. And this time it is specifically for us, the perinatologists and neonatologists and pediatricians who have been highlighted in the theme of WHO. Over to you, Amit.
Thank you, sir. I'll have just another brief introduction about the World Health Day. Can you please show the slide, Dr. Debra? So, on this World Health Day on 7th April, with the theme being Healthy Beginnings, Hopeful Futures, I welcome our chairperson, Professor Ranjan Kumar Pejawar, who is best known as his perinatologist, who runs his perinatology journal for few decades now. And he's the past president, NNF 2021. He was one of the most innovative presidents NNF has ever had. Welcome you, sir. And
thank you.
We have Professor Neelam Clare, madam, who is chairperson, Department of Neonatology at Sir Ganga Ram Hospital. She is also our past NNF president She was of the era when 2 years presidency was there. So she is privileged to be the president for 2 years, 2009 and 10. And she has won the Padma Bhushan in 2014. And we are very proud of that as well. Welcome you, Neela Madam, for this program. Thank you for
Thank you.
gracing the occasion. Can we move on next? World Health Day, which is organized annually on 7th April, is a global health awareness day celebrated every year under sponsorship of World Health Organization, as well as other related organizations. Each year, this day highlights a specific health theme of global significance. In 2025, the theme is Healthy Beginnings, Hopeful Futures, focusing on maternal and newborn health, which are the core issues which NNF deals with as well. Next. So talking about the global context, maternal and newborn health remains a critical concern worldwide. Each year, approximately 3 lakh women die due to complications during pregnancy or childbirth, which is a huge number. Additionally, over 2 million newborns die within their first month, and around 2 million more are stillborn. So this is the 4 million mortality which we have, which is some of it is preventable, but some of it may not be. This equates to a preventable death every 7 seconds, underscoring the urgent need for action. Next. India's progress and challenges are different and much bigger. India has made significant strides in improving maternal and child health in last decade or so. MMR has achieved significant reduction. MMR has declined from 2014-16 to 2020 data quite significantly, reflecting enhanced healthcare survival and targeted interventions. Under 5 mortality has also reduced by almost 80%, which is much more than the global reduction during the same period. Next. So the objectives of the World Health Day are the campaign aims to end preventable deaths, encourage governments and health communities to intensify efforts to eliminate preventable maternal and newborn deaths, prioritize women's health, that is, emphasize the importance of addressing women's long-term health and well-being beyond childbirth, and promote quality of care, advocate for respectful and high-quality care during pregnancy and childbirth, ensuring women and newborns receive dignified and effective services. Next. So, the action for these objectives are: it is crucial for policymakers, healthcare providers, and communities in India to invest heavily in healthcare infrastructure, strengthen facilities to provide comprehensive maternal and newborn care, especially in underserved areas. This government has done wonderfully well, making almost 1,000+ SNCUs in very remote areas of the country as well. So India is investing in healthcare infrastructure significantly. Other important thing is to address gender disparities, because we all know that mortality rates still are higher among girl children and girl newborns. A part of it is related to lesser care which the family is keen to give to these female children. So that has to be improved, and enhanced postnatal support, that is, provide continuous care and support for mothers and newborn beyond immediate postpartum period to ensure long-term health benefits. That is, post-discharge follow-up is key and is very important to improve our neonatal and under 5 and infant mortality rates. That's it. So with this, sir, I open the house for you, and I request you to please invite Dr. Ranjan sir to please introduce and invite our first speaker.
Hello. Good afternoon, everybody. It is a very good webinar which has been arranged, and I also should re-emphasize that the theme, the World Health Day theme, is very, very relevant to us neonatologists and pediatricians, especially as our targets are closing in on us. We have hardly 5 years now to reach the INAP goals / SDG targets, all. Whether we're going to reach or not is a different matter, but we should not loosen our morale and our grit to try and reduce it as much as possible. The NNF has arranged very relevant lectures for this program, and I commend them. And I think we should start it straight away. I don't want to stand between the audience and the speakers. We have ample time to discuss, I hope. The first speaker will be Dr. Sri Shailam Kotturu. He is affiliated to Ganga Saraswati Children's Hospital in Islamabad. Am I right? He's the first speaker.
Dr. Anupma will be the first speaker.
Then it's just introduction only. Is it?
Yeah, Dr. Anupma Reddy would be the first speaker.
Okay, you want me to introduce Sri Sailam later?
Yes, okay.
One after the would
Okay.
be better, sir.
Neelam ma'am.
And
because it goes from pregnancy to childhood. To
Yeah. Yeah, I would like to thank Manoj and Amit for selecting a lovely theme for this webinar, Healthy Beginning, Hopeful Future. So if you want a joyful or a fulfilled life, for kickstart of the life, I think continuum of care is very important. And I think WHO, UNICEF, everybody has emphasized that obstetrician, neonatologist, pediatrician, so that we are starting from the pregnancy to adolescent to have a kickstart of good health. So thank you very much for having me. And I think since we are talking about healthy beginning, so we start with the pregnancy. And I think the first topic, Amit, are you going to introduce Dr. Anupama or because I think I don't have her CV, but I know that she is a good perinatologist and she's from Hyderabad. And she's going to talk about Power of Positivity, a guide in joyful pregnancy.
Yes, ma'am. She's a pediatrician.
Anupama, maybe you can introduce yourself and maybe start with the first talk. What do you say, Amit and Dr. Manoj and Dr. Ranjan?
Dr. Anupma Reddy has been a pediatrician at Fernandez Hospital for last many few years and doing a wonderful job as a colleague to their neonatology friends. And we welcome Dr. Anupma Reddy for her lecture, please, ma'am.
Thank you, Amit, for rescuing me. I've been to Fernandez Hospital and welcome, Anupama. The floor is all yours.
Thank you. Thank you very much. Thank you. Good afternoon to all my seniors. It's a great privilege for me to actually be here. Dr. Ranjan sir, Neelam madam, we've always seen them on the forefront. Dr. Manoj now over there with Dr. Amit. Thank you very much for and Dr. all the doctors here, the seniors here. Thank you for the NNF Telangana team to have included us in this project. But just to give a brief introduction, because I know there was a little bit of trying to understand who this is. So like it said, I was associated with Fernandez for many years, but later stepped down from corporate practice. Now do more of charitable work at the Vivekananda Health Center, Ramakrishna Math at Hyderabad. And the thing is why this topic is very relevant for us to talk about is because in this course of time here, we've spent a lot of time understanding what we're talking about right now, healthy beginnings, which means from the mother to the fetus. And we do a project called as Arijanani, where I'm a vice president of the trust. So we've managed many thousands of mothers in that forum. And I'd like to discuss some of this subject here because it's very relevant for us to talk about prevention and healthy beginnings. So if I'll just share the presentation, we can start. Sir, is it visible?
Yes, ma'am.
You're
Thank
visible.
you. Thank you. Yeah. So as we started to say that there's nothing more important than the fetus to actually be born. And for the fetus, the impression which happens is from the mother. So it is very important for us all to address what happens in the mother. And that goes on to become the programming for the children for tomorrow. So what happens as maternal problems, the first subject that we need to think about is maternal stress. So let me just. So during this presentation, the learning objectives are actually learning more about the mother, and the most important problem there we have is the maternal stress that we are facing more and more nowadays with all our mothers, whether it is in the corporate sector, any other thing. It's the maternal stress, which we'll talk about a little bit. How do we handle it through the conventional methods of yoga, deep relaxation techniques, and meditation? What is the basic phenomena in this, which we call as epigenetics, biological embedding? And finally, we will end up with learning the whole solution to all these problems through prenatal bonding, positive beginnings, and positive programming to the fetus and the child. So when you look at perinatal mental health itself, why we are talking about it is perinatal mental health is something which happens throughout the pregnancy and up to the first year after birth of the child. And in some of the studies, this representation of the problem is almost more than 25%. It's actually around 27% right now. And if you look at it, this problem per se is much more important than all other problems of high risk obstetrics. Whether you're talking about preeclampsia, diabetes, any other problem, definitely perinatal mental health has a higher role to play as a problem for our clinicians to solve. Because it is not only, it does not have only maternal implications in the form of medical, physical, emotional, but also a lot of effect on the child. So there are a lot of studies and they try to say what exactly affects the perinatal mental health. As simple as acute and chronic stresses, like a long commute, relationship problems, financial problems, natural disasters. We saw a lot of it during COVID and the effect of it on the baby, and also death of a close family. These are some of the chronic stresses which every human being faces, and particularly what happens in the mother is that when they have these problems, it has a long-term outcome of pregnancy outcomes and neonatal morbidities. In the sense of the gestation age at delivery, the mother can go into spontaneous birth, or there could be a medical problem where which the pregnancy has to be, indicated, earlier birth has to be done. The neonatal birth weight and even pregnancy complications like eclampsia, we know postpartum depression is also a common problem. And long-term neonatal and maternal morbidities are also known. So some of all the effects which happen directly from maternal stress is that it can have up to 25 to 60% of preterm births can be the only reason for that could be the stress the mother is going through. Low birth weight is common, and developmental delays in the low birth weight is also a common known knowledge in this. So what happens exactly is when the mother goes through anxiety, her negative hormones, that means the adrenocorticotropic hormones, the cortisol increases. What happens when cortisol increases is it crosses across into the fetus, and actually the fetus is the one which contributes towards starting of the intrauterine contractions. And that's where you get the preterm birth. The cortisol in fetus also can decrease the birth weight. Intrauterine root restriction can be caused by that. Not only that, maternal stress is known to double the risk of behavioral problems in children, even up to, when studies show up to 4 to 7 years, you find more anxiety in these children. It is not only at this level, but it has got a far-reaching effect on the psychological, on mother's psychosocial effects on this child development. The list is never ending. In fact, over 12 months, mental development scores, attention deficit, ADHD, sleep, behavioral, emotional problems, autism spectrum disorders, greater impulsivity in adolescence, something which our adolescents are facing a huge problem with, reduced telomere lengths. Telomere lengths are the ends of the chromosomes, and it means that the lifespan of the person decreases when you have a reduced telomere length. Now, schizophrenia is also known to be associated with all the effects, long-term effects of what happens in the child of future. So it is impossible to help mothers when it's such a large level of a problem and its repercussions that we can use medication for it, or you don't have enough clinicians like psychologists to help the system. So this is a beautiful study which showed that it was published in AGOG, which showed that we need to use non-pharmacological approaches for reduction. And these studies looked at mindfulness, meditation, which is mantra meditation. And they also looked at biofeedback, which is breath work and how you decrease the heart rate and heart rate variability of the mother. Yoga, which is asanas, again, pranayama, exercise, minimum of 25 to 30 minutes. So all these things, and journaling, expressive writing, which acts like a psychologist to the mother herself. So this can be practiced by the mother and help in this whole process of maternal stress. So when we looked at this, we actually had multiple, like I mentioned, work going on in this, and prenatal yoga becomes part of the practice. But how does yoga really help us? It is very clearly shown that it decreases depression, anxiety, anger scores. It lowers salivary cortisol and increases IgA levels. It allows the mother to deliver later, which is a big advantage for the fetus, from 36.7 to 38.6. It increases birth weight and also reduces section rates. So these are huge benefits. And even deep relaxation techniques, which conventionally we call as yoga nidra. And this comes out through progressive muscle relaxation, guided imagery, and positive affirmations. It's huge because it helps the vagal systems to help, and it allows the blood circulation to your uterus to improve. So obviously this controls stress also. It decreases maternal morbidities like preeclampsia. Most important thing is by guided imagery and positive affirmation, there's a constant bonding which happens from the prenatal stage itself to the unborn baby. Meditation, of course, is the deepest form of deep relaxation techniques. It improves the attention and emotional regulation. It definitely helps anxiety, depression, and the perceived stress also of mother. And ultimately, when we even directly speak to these mothers, they feel their character transformation also happens in this process to become more calmer and peaceful. So all these mechanisms, how does it happen? I mean, the adaptation which happens in a human being happens right in the beginning. That means in the fetal stage, where the phenotype actually adapts to the physical environment around the mother, so that there are long-term consequences of whatever the fetus is facing from within the mother. And the most important mechanisms in this biological embedding, which is talked about, is epigenetics. That is, the genes itself listen to the environment. And the second mechanism is synaptogenesis, where the brain listens to the environment exposed to the fetus and to the baby in the first 1,000 days. So how the epigenetics effects are is, it is very interesting to note that it is not as standardly thought, as conventionally thought, that we don't have a single static genome. Now it is very clearly defined that it is a dynamic genome, it's a developing genome. And this is because of the interplay between the genes and its environment. And why we are talking about the first 1,000 days is this is when the sensitive periods of development happen. Like in the fetus, the whole organ systems are developed. It is only the brain, the immune system, and the liver, which after birth is yet to develop. Otherwise, most systems are developed in the womb. So whatever the baby is exposed to through nutrition, environmental toxins, whether it's abusive behavior, and of course, maternal stress, the epigenetics actually finds a place in here to explain what happens to the fetus and the child. Now it is known that epigenetics can be inherited also. Here, again, in a very interesting study which shows that grand maternal stress during pregnancy and DNA methylation of the third generation. That means the effects we see in the third generation. So it means that whatever the mother is passing through actually passes for the future generation in totality. So knowing all this, epigenetics also talks about now the most crucial thing, which is nature versus nurture. It is an interplay between the genes and the nature and the nurturing system that we're talking about. So this is a famous experiment which is done on mouse, and how the pup mouse was nurtured. Based on that, the developing genome changes and the character of the adult pup also changes. When nurturing happens well, that means when the pup is nurtured immediately after birth within the first 1 week, that is a highly nurtured pups, what happens is their GR gene is active. And this allows them to become calmer and relaxed when under stress. Whereas when a low nurtured pup, the GR gene is inactive. So that means they're epigenetically silenced. And this way, they are not able to, actually, they have a very hard time relaxing whenever they're stressed out. So this is how we are able to show that it is actually the communication with nature and also nurture together, which makes the individual what they are, either a contributive person to the society or have their own problems with their own nature too. So that is where we are talking about prenatal bonding, which is a positive programming system which happens. And the more it happens from the womb and later, the nurturing happens after birth, there is a huge difference to the baby and the child. In the womb itself, the mother and baby are a very, very constant diet. That means whatever the mother is doing actually is perceived by the fetus. There's no other world to the baby in the womb. And the first sense which develops in the womb is as early as 8 weeks in utero. That means just 2 months. And hearing in the womb happens by about 18 weeks to 20 weeks. And that is the reason for why prenatal bonding can be exposed in the form of loving strokes to the fetus. Music has a huge role. In fact, soft music plays a very good role for decreasing the heart rate of the baby inside the womb. Singing has large benefit. Baby-directed communication and also positive thoughts. In whichever way we can create positive thoughts, it helps because every emotion is carried through our hormone system to the baby inside the womb. So this was, again, very good research done by Rafael and group in Switzerland. There were 188 facilitations which were done for 5 years. And this was a study which clearly showed that by good prenatal bonding, the breastfeeding rates have improved. Breastfeeding after 6 months, from 22%, it has increased to 92%. Postpartum depression definitely decreases. And even infantile colics, which is very clearly known to us is due to maternal stress, has come down to almost nil by just simple prenatal bonding. So the significance of prenatal bonding is again far-reaching in the sense that it reduces the negative hormones, that is the cortisol levels in labor. It decreases pain and shortens labor. Cesarean sections are decreased postpartum depression, increases breastfeeding rates. But what is more important than maybe all this is that it improves the infant's neuronal and behavioral growth. And this is seen in our regular representation of what we know, that babies are born with 100 billion neurons at birth. And this happens as much as possible if the pregnancy goes up to, in fact, it shouldn't be taken. 37 weeks is not the term. I think what we should do is 39 weeks because that is when actually the baby is completely mature in its neuronal systems. After that, within the first 2-3 years, there's a lot of synaptic connections. 700 to 1,000 connections, synapses happen per second. And all these nerve links happen only by one single phenomenon, which we call as serve and return. Serve and return is basically the communication which happens between the baby and the mother, which helps in this synapses to develop and forms the ideal environment for a baby to grow and stimulate it positively to make a positive programming for a lifelong consequence for this child. So this reminds us of this great scientist, Dr. Thomas Murney, who's a prenatal psychiatrist. And he's clearly defined now, we know, is that the womb is the child's first world. How he or she experiences it, friendly or hostile, does create personality and character predispositions. And I would like to end with the saying of our great sage of India and our tributes to the greatest minds, which Swami Vivekananda has clearly said in his own statements to say that it is the prenatal influence that gives the impetus to the child for good or evil. Go to 100,000 colleges, read 1 million books, associate with all the learned men of the world. Better off you are when born with the right stamp. So this creates a future generation in a significantly much better way when the mother and baby in the womb are taken care of with the utmost care and bonding. So thank you very much. I think World Health Day, we need to really appreciate all our mothers who hold the world in their womb and create in spite of all the problems that she might go through. Thank you very much for this chance. Thanks.
Thank you, Anupama. Indeed, a excellent presentation. And I loved your last two quotes. It's said that, if you educate a mother, you educate the whole community. So I think we should pass on this knowledge to the young mothers, and maybe NNF should take a responsibility of, educating the young mothers, the college going, the school going, adolescent girls. And thank you for sharing your wonderful work. I'm sure my co-chair, Dr. Ranjan, would like to add something before we go to the next presentation. Amit, do we have time or?
Yes, ma'am. Some
You're a
last
timekeeper.
words from Dr. Ranjan
Yes.
before we go on to the
Indeed. Thank you, Dr. Anupama Reddy. That was a wonderful lecture. And everything starts at or just before conception and during the pregnancy. Newborn is just a continuum of the fetus. I always feel that the perinatal approach is the best approach which will bring out the best outcome of mother and child care. And your talk re-emphasizes the health education that should be given to the young mothers, and both at the hospital and afterwards at home. So the caregivers and the extended family play a large role. Health education and support to mothers is very, very important. And that is something I think we should agree with Dr. Neelam Claire, that we should give more importance in the days to come in the NNF. We have achieved a lot as far as hardcore medical care resuscitation is concerned. We should also add to that the health education and counseling and support whenever required, wherever required, to the mother. Thank you.
public awareness and charity. These are one of the key objectives of NNF since it has been formulated. But we have been lagging behind on both. And so there is some area in which we need to do more. So I agree with both our chairpersons and our past presidents, and we look up to their guidance for improving upon in this area. We are still more inclined towards lectures and all, which gave us hardcore knowledge about neonatology. But this soft power, which Dr. Anupma talked about and which Dr. Neelam emphasized, that has to be inculcated more as well.
In fact, Amit, there is a comment in the question answer box by Subhadra, very beautifully illustrated that not only the mother, the boys and girls and the family should be educated about the knowledge you're talking about. If we have to, make sure that we have a healthy kickstart. And today in India, the number of working women is increasing, from what it was 10 years back or 20 years back. So obviously the stress
Definitely.
is also increasing.
Very healthy environment
Is very
we should see, with parents quarreling at times in front of the kids doesn't pose a very good picture and has a very bad mental effect on the baby child as well. That has to be seen.
And I
Message
think
to
we should be talking about holistic health. And maybe, Amit, you could give a message to the participants that they can post their questions so that, they feel that they are being part of the discussion.
Yes, ma'am. So any of the participants, if you have a message or a query, we can have them from you, and we will raise that to the speakers as the webinar goes. Thank you, ma'am.
Just a short comment. I really like that comment on the fathers being there, but incidentally, the workshops definitely have, we insist that the father comes along and the partner comes along. So it makes a lot of difference because the support they give after listening to whatever is required is really an extra benefit for the mother. Thank you, ma'am, for that.
Definitely. I just saw a movie test in which the lady used to go for infertility treatment, and father would hate it all the time, and he would never like to go. And so that is a message which probably that movie should go. And now over to the next lecture. And Dr. Tejo, he has a wonderful topic to say. And Dr. Tejo is a very senior neonatologist who did his DM from AIMS. He is at Fernandez Hospital, and he's an avid researcher publishing every month in one or the other journal. Very recently, Dr. Tejo has published his growth curves from almost a lakh of babies born at the Fernandez Hospital. And it's a wonderful paper which all can look at as well. And it's over to Dr. Tejo for his wonderful lecture on protecting brains and building futures, neuroprotection strategies in the NICU. Dr. Tejo.
Thank you, sir. Thank you, Amit, sir, for the nice words. Um, from the continuum of the antenatal interventions, which are very soft interventions, which we need not do much in terms of costing, but very simple interventions which can really benefit the fetuses which are growing. I just wanted to continue the same into the NICU also, where we do not invest much cost, but simple hand holding and doing things with some love, and then with more consciousness that can improve the baby's outcomes. So I just wanted to keep one disclaimer here. As neuroprotective strategies for term neonates and preterm neonates, we have a little difference, but for the sake of lecture, I just have incorporated most of the things related to the preterm neonates only, because that's where our more emphasis is there currently, as the survival of the preterm neonates are increasing. So we will just first see why they're vulnerable. I think Dr. Anupama Madam has already told about this, some of the aspects and some of the preventive strategies which we can try to do it, and what is the future that holds on, any other molecules and other things are there for us to prevent this these brain injury. Okay, just continuum of the slide what Dr. Anupama Madam has kept it. So the brain size will be very smaller while the baby is getting born at preterm, whereas compared to the adults, it is much lower. Okay, it actually, what does it mean is that the surface area of the brain and the content of the brain is also lesser, but it has a larger potential to grow it, because as you can see here, the number of neurons and other things are reasonably okay, but folding indices and other things will start happening at the later stage of the life only. Okay, so the preterm brain has a potential, but the insults can make the preterm brain to more vulnerable for injury and then cause the long-term problems in these children. So the two most important aspects of the preterm brain injury are intraventricular hemorrhage and periventricular leukomalacia. So we need to concentrate on some of the interventions where we can try to decrease the incidence of these dreadful conditions in our preterm newborns. I'm not going to the statistics more because already Dr. Amit sir also has told about the same. So if you look at the pathophysiology of IVH, it's very complex, but two things that are important for us are, in phase 1, it is mainly the cerebral ischemia, which is the culprit that can cause the general matrix hemorrhage. And in the second phase, it is a reperfusion injury, which will cause the injury. These two will go in hand to the baby and then cause the incidence of IVH a little more. But why we are worried about, even if it is a IVH. The main problem lies here. So the cerebral cortex and thalamic dysmaturation can occur, decreased myelination can occur, axonal injury can occur, even the dysmaturation can extend to cerebellum also, which can lead to much more problems than what we anticipate in these newborn babies. The main culprit in these preterm babies is the deranged autoregulation of the brain circulation. The term what we use is the pressure passive circulation. The literal meaning is that whatever is happening in the systemic circulation, the changes, they are getting reflected in the brain circulation also. Why it happens? Because these preterms have a very narrow range of cerebral autoregulation where the pressure variations will not occur only in this area, whereas in child and adult you have a little wide range of pressures where the reflections won't go into the brain. So that has been reflected on the bench studies also by NIRS changes and other things. As you can see the map, which is getting reflected again on the oxygen extraction capacity as measured by the NIRS that you are looking at it. So what are the factors that can affect this cerebral circulation? The main culprits will be either they can decrease the cerebral blood flow or they can increase the cerebral blood flow. So the increased cerebral blood flow can be caused by hypoxia, acidosis, increase in the CO2, hypercapnia, hypoglycemia, and hypocalcemia. Whereas the brain circulation will get decreased with hyperoxia, alkalosis, hypocapnia, and hyperglycemia. So we should try to adjust these metabolic disturbances, and the ventilatory adjustments also should target not to expose the baby to the hypoxia and hyperoxia or severe hypocapnia and hypercapnia, so that you will be able to make the better choices. Second major brain injury that we have discussed is the periventricular leukomalacia. The three main culprits that are there for the periventricular leukomalacia, as you can see in this pathway also, whether it is a primary, secondary, or tertiary insults which are happening, the main culprits are these. How they will reflect onto the baby's body? By either infection or inflammation, ischemia, or hypo or hyperoxia. All these things can lead to the problems in the baby, which can lead to indirectly the preterm brain injury, that is a periventricular leukomalacia, thereby reduced brain size and the gliosis which will happen in these babies. The pathway of this infection, inflammation starts from the antenatal aspects to postnatal aspects. They have a multiple mechanisms, but I just wanted to emphasize that even the antenatal inflammation and infection, which will happen either due to the stress related to the IUGR or chorioamnitis, that can again pass on to the baby, and there also problem can occur. Once the baby comes to the postnatal area, what are the things that we can do by monitoring and also adjusting the environment in the baby? Thereby, we can prevent this preterm brain injury. The interventions again start from the antenatal aspects. The most easily done and the low-cost measures are the antenatal steroids and the magnesium sulfate. The guidelines are already there. I think most of us know that for less than 35 weeks of gestation, we need to advocate the steroids. At least one single course of steroids, we need to do it. For all the babies who are getting born less than 32 weeks of gestation, for preventing the brain injury, we need to advocate magnesium sulfate also into these babies. Now let's come to postnatal interventions which we can do. They should start from the resuscitation and then go on to the postnatal aspects. During resuscitation, the most effective way of doing the brain protection is the delayed cord clamping. Again, it doesn't require any money, so you can just hold on your nose. If the baby is crying, wait for 30 to 60 seconds. There are more benefits than if you cut it early. So physiological benefits are also there, and the clinical impacts also have been shown by reduction of the mortality, reduction of the IVH, and improving the hemoglobin and reduction of the inotropic usage in these babies. Number of meta-analyses are also there, which have shown reasonably good benefit in reduction of the IVH, that is almost like 15 to 25%, as you can see, with high certainty the recent 2 meta-analyses have shown. Second option, if the baby is not crying, is the umbilical cord milking. Both the cut cord milking or intact cord milking, we can try to advocate. However, it is contraindicated currently as per the new NRP guidelines if the baby is getting born before 28 weeks of gestation and non-vigorous, as the chances of IVH will be little more in these babies. Other interventions which have rationale in the management are during resuscitation, dermal management, use the plastic wraps liberally so that evaporative heat losses are lesser. Use a gentle positive pressure ventilation by using a T-piece resuscitator and saturation targeting. Initially start with 21 to 30% and then keep on increasing it. While you are doing chest compressions, care should be taken not to overdo it, and also manage your team well so that you will be giving better outcomes. Next comes is a thermal regulation throughout the stay in the hospital, from the time of birth till the baby discharges. Both the neonatal hypothermia and the hyperthermia both have impact on the brain. Hypothermia, we know that the anaerobic metabolism will increase and then metabolic acidosis will occur, which can lead to the IVH, because acidosis can cause the IVH in the baby. In the hyperthermia, increased blood-brain barrier permeability and cerebral edema, again, metabolic demands will increase that can ultimately lead to neuronal injury in these babies. So both are important, and we have to control both and try to maintain the normothermia. It has been shown in the studies also. This is a very big study which have been published in the JAMA Pediatrics in 2015. As you can see, in this narrow zone where we usually keep the baby between 35.5 to 36.5, and we do not want the baby to go below 36 or above 36.5, the incidence of IVH is higher, either it is lower or also when it is on the higher side. So both hyperthermia and hypothermia are detrimental to the baby and can cause more IVH and PVL, as shown in this table for you. Next one is the ventilation strategies. Whenever possible, we usually advocate the non-invasive ventilation, as the baby can control both the CO2 and oxygen in much better way than the invasive ventilation strategy. However, when you do not have the option of continuing on the NIV because of the baby's condition, then you can go with the volume guarantee ventilation that has been shown to reduce the cerebral blood flow fluctuations and lower incidence of IVH and less volume trauma. As a volume guarantee can increase the stability on the CO2 levels and decreases the volume spikes, thereby reducing the cerebral hemodynamic instability, the volume guarantee ventilation is much better than your normal pressure pressure control ventilation in these neonates. Another important one is the targeted saturations. Again, both the hypoxia and hyperoxia, as I have shown in the previous slides, are very detrimental to the baby. Hypoxia can cause ischemia, hyperoxia can lead to oxidative stress and other things. It has been shown to increase a little brain injury, and high SpO2s especially increases the risk for ROP, though they have shown that there is a marginal improvement in the survival. But low SpO2 again can increase the mortality. So recommended is around 90 to 95% or 91 to 95%, which we can try to do it. Apart from oxygen, we need to concentrate on the CO2 also. As you can see here, if it is moving to the highest quartile, the risk of PVL is increasing. That means that this is the time at which the baby is exposed to the inadvertent hypocarbia. That's where the increase in the PVL is occurring here. Okay. Other care-related events that can lead to increase in the intraventricular hemorrhages are suctioning. Again, can cause problem if you do not do a gentle. Early CPAP and permissive hypercapnia has shown to improve the outcomes. While you are managing the baby and the hemodynamics, rational management of the PDA, try to avoid the rapid boluses and the hypertonic solutions, and don't do very fast blood drawing also, especially if you have a arterial catheter with you, and adequate management of shock will try to improve your outcomes. Infection control, I don't need to tell about much on the same, because the inflammation directly can kill axons and which can lead to axonal injury and preterm brain injury in these babies. Apart from these intervention related things, some of the care related issues are also very important for us to prevent the IVH. So the main advocacy, what experts are saying, is that we need to keep the baby in the neutral position. What does it mean? No flexion, no undue flexion at the neck. Use a little shoulder roll to keep it at mild extension. Head and body should be in the line. Sniffing position will try to help the baby. As you can see here, a little head tilt also will try to help the baby to decrease the passing of the pressures that are getting changed in the thorax to the brain. A 15 degrees tilt has been shown to have a better outcomes than the supine position in the baby. At the same time, handling where diaper changes. If you lift the baby's legs up, thereby some amount of systemic circulation is going suddenly into the baby's brain, that can also cause IVH. So we have to be careful. We have to keep it onto the line, not above the baby's head. The leg position should not go above the head, so that you will be able to decrease the IVH in these babies. And try to avoid these acute rotations in the baby. Again, this also can cause more IVH in these babies. While you are keeping it on the side position, okay, so then undue head and body should be in the same line. If you keep the head tilt too much, that can cause the venous circulation arrest, which can lead to, again, hypoxia, metabolic acidosis, and then IVH in these babies. Apart from position, more advocacy on use of human milk and breast milk specifically will try to help the babies to prevent brain injury by improving. It has a lot of potential in terms of nutrients. It has good microbia, which can reduce the infection, stem cells, which can regenerate the things, and it has also has been shown to improve the epigenetics in these babies because that has some of the products of nucleus, thereby it will try to improve it. This is one of the landmark study. As you can see, the breast milk has been shown to improve the indices almost by 4. So thereby the baby will have a better outcomes in this. Last but not least, the intervention is your DSC. You need to create a healing environment for the baby, where the baby will have good safeguarding of the sleep, while protecting the skin, optimizing the nutrition, improving the family participation, and minimizing the stress. Why it is important? As Dr. Anupama was also telling, the initial world in this baby is the womb, whereas the baby is coming out to a stressful environment into the NSAO, where we need to try to protect these special senses with varied interventions in a systematic manner. The sequence is the way the baby's special senses will develop, initially tactile, later on visual. Series of interventions, like for the tactile, you can do the position strategies, gentle touch, and other interventions for the visions like light and sound exposure by doing the protected sleep and increasing the parental involvement. And for the tactile stimulation, you can do the position changes, waddling, nesting, facilitated tuck and gentle massages. It doesn't require too much of science or anything. We just need to train our nurses for these type of positioning so that the baby will feel as it is in the womb and there will be less stress for the baby. Gentle massages while they are applying the oil routinely, not shearing, do not have more shearing pressure on the skin, thereby prevention of the skin injury also will happen. And decreasing the sounds for the baby while dragging the chairs or anything, or also promoting some music, either the mother's own voice or any soothing music, that also babies will get benefited, and try to control the noise in the NICU. And other most neglected DSE intervention is the pain protection. We usually do not keep so much attention to the same, but we need to remember that all the babies have the pain perception, and we need to try to use some non-pharmacological measures at least to prevent the pain in these babies. Visual stimulation comes at the end, at least around 31 to 32 weeks of gestation. By using a just black and white boards, you can try to increase the baby's visual stimulation, and thereby the baby will have a better outcomes. Switch off the lights while they are not required and the monitoring is not required, and try to crowd the procedures and then try to keep while you are switching on the lights on the same. KMC is one of the best developmentally supportive care which can create the holistic environment for the baby, and then it will try to promote the baby's brain. Family participation will elevate both the stresses either in the mother and the father and also the baby, so that we can try to improve the family-centered care in all our organizations, and uninhibited access for the parents to come and spend the time with the babies, that will also improve. There are many interventions like what I have told, but if you bundle it, then the outcomes will be much better. You can use a switches model also, thereby a layer protection will happen to the baby. Some of the quality improvement pathways that have been proposed are these: starting from the birth in a tertiary center, management of the high-risk pregnancy, care during the initial 72 hours, and standardized follow-ups in these babies. There are multiple interventions you can try to do for all these 4 items and start making your smart aims and then try to promote it. It has been shown even in the WAN network that quality improvements have improved the improved the outcomes by reducing the severe IVH from 25% to 10%. And simple in-service trainings also, as you can see, it has reduced the severe IVH in these babies. Okay. Other interventions that we can look at is the rational management of the seizures, and some of the drugs which we can try to use is the caffeine, probiotics, DHA, INO. Right now, if your baby is having high FiO2, other things like stem cells, erythropoietin, melatonin, these are all still in the experimental therapies. Some future directions for the NICU are maybe integrating our NICUs with the AI technology by a good loop feedback systems, and thereby we will try to know when actually the event is happening or whether the baby is having a predilection for the IVH or brain injury, and what interventions we can try to do it. So time series events also can predict the IVH for the baby. Okay. Our role doesn't end. I'm just continuing with 2-3 slides here, and then I will stop my presentation. We need to follow up these babies, which are very important. The follow-up should involve all these aspects. The more important one is the ROP screening. Before 30 days, all babies who are born 34 weeks of gestation and less than 2 kilos should get one screening around 28 to 30 days, so that any baby who is having the severe ROP can get treated and prevent the blindness. Hearing screening must for all the babies who are going out from the NICU as a high risk. At 1 month, by 1 month, 1 year early screening, by 2 months, diagnosis should be there. By 3 months, we should start doing the interventions. So these are the things that I wanted to take you attention. So first one is the preterms. We all know that they're vulnerable for brain injury. A structured protocol integrating all these interventions will try to prevent some of these injuries. Quality initiatives with bundled approaches have shown promising results. Integrating new technologies might help in prediction and adjusting our care-related pathways. I'm hoping that together we shape a powerful start for our tiny warriors. Thank you for giving me this opportunity.
That was a wonderful talk. Very exhaustive, comprehensive. And over to our chairpersons for their comments and
Dr. Neelam.
Thank you, Tejo, for a really very, very comprehensive presentation covering all the NICU interventions to protect the brain. And I think the message should be that we should have brain-friendly NICUs. And maybe AI would produce a model that, would say that your sound is above the allowed or permissible decibels, or your light is more than the permissible decibel. So I think we have to emphasize the staff, because the environment of the NICU is created by the staff. So our nurses, our resident, everybody, like when you're closing the door of isolate, or when you're talking on the rounds, that, you are taking care of it. And I think antenatally also we should have a kind of rapport with the obstetrician, that we emphasize the use of antenatal steroids and also magnesium sulfate wherever indicated. And postnatally, of course, you very beautifully you illustrated that your job doesn't finish at the NICU and discharge, but following these babies is very, very important. I'm sure there'll be comments from Dr. Ranjan and some questions. Dr. Ranjan, over to you.
Thank you, Dr. Claire. Thank you, Tejo, for a beautiful presentation. I liked your subtle points, which are often forgotten, about not just hypocarbia, but even hypercarbia. Not just about hypothermia, but even about hyperthermia. I appreciate that you have brought quality of care in your talk. Improving the quality of care matters a lot. And we have seen enough evidence about that. And most of the things which you have mentioned, interventions, we need the cooperation of the obstetrician, right? May it be usage of antenatal steroids, magnesium sulfate, or deferred cord clamping, various things we need their intervention. So we have to work as a team. Nurses, of course, the backbone of neonatal care, and they should be given more empowerment, especially these developmental, supportive care, and follow any day, very, very reliable and very, very dedicated in what they do. And their thirst for knowledge is very high, as we have seen in the CMEs. Thank you. Thank you once again.
Thank you, sir.
So should we move on, Dr. Ranjan, to our next topic? Dr.
Yeah,
if you could introduce Dr.
Yeah.
Sri.
The third talk is going to be on window, positive preventing for a strong start. Dr. Srishalam Kotturu is the young, energetic neonatologist. He is affiliated with the Ganga Saraswati Children's Hospital. Please note the versatility of Srishalam. He is the president of NNF Telangana. He was the president of Nizamabad IAP. He is the Telangana State Academic Coordinator for Basic NRP, and he's the Advanced NRP and BLS instructor. What more do you need in a speaker for today's theme? right? He's
Yes.
a true all-rounder. Over to you, Sri Sailam.
Dhanyavad, sir. Thank you. I first of all like to thank the NNF team for giving me this opportunity, and thank you for your lovely introduction, sir. Devarun, can you share the screen? Yeah. Are you able to hear me?
Yes, we are able to hear you.
Yes, sir. You're audible.
Yeah. So now regarding the golden window. Now every parent wants to bring out the best of the child. Parenting is one of the best crucial determinants of a child's development. The early years of life, it lays the foundation for cognitive, emotional, and social well-being. The next slide. The term golden window, it refers to the critical period of early childhood, particularly the first 5 years of life. Next slide, please. Now, why is it called the golden window? It is this period when the brain is more receptive to learning, adaptations, and growth. During this period, the positive experiences and responsive caregiving have a profound impact. And that's why it's called as the golden window. And during this period, the peak development of the brain happens. The brain reaches approximately 90 to 95% of the adult size by age 5. Approximately 1 million new neuronal connections per second are formed during the first 5 years. Next slide. Another very striking feature is that when we talk of the development, it is the physical development. And if you look during the infancy, it's the period of the rapid growth. The weight doubles by 5th month and 3 times by 1 year and 4 times by 2nd year. If you look at the height, at birth, if it's 50 centimeters, 25 centimeters in the first year and around 12.5. So the child reaches 85 centimeters by 2 years. So any growth faltering in this period is really leads to stunting for the rest of the life. The next slide. Just going to the neuroscience, the stages of the brain development. If you look at the image, the first 3 images where it shows the various neurons. Hey, keep the slide. So this is the cerebral cortex. If you look at by the age of 3 months to 9 months, the number of neurons are similar to those which a child at 2 years or an adult has. But what is so striking is the multiple networks, the connections, the synaptogenesis that happens. And if you look at the second slide, after the synaptogenesis formation, but later in life, if you look at the 4th, 5th, and adult, these synapses, they are not so much tightly, you can see as in the previous image. It is because of pruning. That is important feature where those which are rarely used or not functional, they lose. So either you use it or lose it. The next slide, please. Now, this is another very good slide to show the development of the brain. So if you look at the image here, which shows that at birth, the brain has around 200 billion neurons, and brain grows approximately 1.7 grams per day. It's a period of rapid growth up to the 1 year. And also, if you look at by age of 1, infants typically understand about 70 words, but they can hardly speak very few. But as you go to the second year of life, there are a lot of communications, as I said, the synaptogenesis that happens across the different regions of the brain. And this rapidly develop, and these connections keep on growing. So by the age of 2, the brain size is approximately 70%, 75% of that. And by the end of second year, from 200 million neurons to 100 trillions of neurons. And it is more complicated structure. And it's almost as 95% of an adult brain. And when you look at the emotional and looking at the development that the child develops, at the age of 2 years, the child is able to speak at least 2 words in meaning. So these are the things which happen and crucial for the development. The next slide, please. Another important characteristic of the brain is the plasticity. It's the ability to adapt and reorganize. And early childhood, it's at peak. So it's making ideal time for learning the foundation skills like language, the emotions regulation, the social interactions, and the motor skills. The next slide. If you look at this period, the brain becomes, as the child grows, it becomes less plastic, but it becomes more specialized. So it makes it harder to change the established patterns. The next slide, please. Now, what are the factors affecting a child development? There are multiple factors. Genetic factors, the emotional factors, the nutritional factors, the physical factors, the social and cultural factors that really influence and affect the child development. The next slide. So whenever some developmental delay, it's a great tendency that we always blame the genes and the genetics. But genetics can explain the occurrence of all these health issues only up to 20%. But what is striking is the remaining 80% that we ignore. The environmental factors, including the nutrition, the lifestyle, that determine remaining 80% are often overlooked and rarely blamed for. So the epigenetics, the environment, has a very, very crucial role in the person's development. The next slide, please. Now, what are the impacts of early interventions? Now, if the child is subjected to early childhood programs, it has a very great returns. If a fixed deposit might yield a maximum of 7%, but whereas any investment during the early childhood days, the returns go up to as high as 13% per year. So to all the stakeholders, it's an important message that do invest, and be to the parents that whatever done during this period, whether in case of improving the education, health, and social outcomes, it is best during the first 2 to 5 years of age. Next slide, please. Emotional and social foundations are laid during this period. So positive interactions by the parents, the caregivers during this period, they have a tremendous influence and they're essential for the emotional resilience, social competence, and mental health. Now, children who receive consistent emotional support in early childhood are more likely to develop strong coping skills and have better mental health outcomes. Next slide, please. Now, if you look at the language development too, various research shows the children who are spoken to, read to, and engaged with frequently during early years, they develop larger vocabularies and have better communication skills. By age 3, there can be a 30 million word gap between children who have been in an environment with language-rich environments to those who are deprived from the environment. So that shows the importance of the early childhood development and the first 5 years of life. Next slide, please. It's very important that if a child who is subjected to trauma at a very early age, they're bound to be delayed. Next slide. So prolonged exposure to adverse environment such as neglect or harsh discipline can lead to toxic stress which disrupts the neural circuits and increase the risk of mental and physical health issues in later life. But in those children who have been brought up, nurtured in an environment where child feel very safe and are supported, they are better, their neural pathways for learning are better, their memory is better, and emotional stability is better in them. So during the first 5 years, the brain, which is rapidly forming neural current, it is highly susceptible to negative experiences. Next slide. Next slide. Now, if you look at the impact on the brain structures, hyperactivation due to trauma can cause lots of fear and anxiety in later in life because the amygdala is affected. A chronic stress, it can impair memory formation and emotion regulation because the hippocampus is damaged. Next. So trauma at the early age can hinder emotional regulation and the frontal cortex is affected, and it's also the decision-making skills of the children is very poor if they are subjected to trauma. A well-known study from in orphanages. Next slide, please. Here you can see the image of a normal child who is being interacted and not living in an orphanage when compared to a neglected child. If you look at that, these children who have been neglected, they have smaller brain values, they have reduced white matter. So such is the importance of interaction, care, love, and affection that is very much needed for the children during the first 5 years of life. So this study was in a Romanian orphanage. It was studied that if these children from the orphanages, if they were placed in a care where they had better foster care before the age of 2, and these children, again, they showed tremendous improvement. Improvement in the brain development, their emotional regulations, and cognitive abilities. This shows that the importance of the care during the first 1,000 days of life. Next slide, please. So any trauma during these first crucial critical years, they can create strong neuronal pathways due to the repeated activation of the fight or flight response. These pathways may be triggered by related stimuli even in the later life, adulthood, when they can get this anxiety disorders, phobia, or post-traumatic stress disorders. Next slide, please. And a trauma during these early ages can lead to some epigenetic changes, like in the gene expression, affecting the stress hormone regulation and emotional resilience too. Next slide, please. While recovery can be possible, but it all depends on the interventions that the child gets. So the brain's plasticity allows for healing and adaptation through positive experiences, various therapies, and supportive environments. Next slide, please. Now, if you look at the experience dependent versus experience expectant development. So the brain development process that require a very common universal experiences. For example, the language, exposure, visual stimuli. When if they are certain age, if they are done, their experiences, if they are missed, it can be compromised for lifelong. So this critical period which exists, it needs a early exposure. So when compared to the experience dependent, like for example, musical training, literacy skills, these continue throughout the life. But when if it is done very early in life, it is very powerful and more skillful the children are. Next slide. The whole focus of this parenting at a very early age is preventing developmental delays. So early detection and intervention for developments by knowing the red flag signs is very important. And conditions such as autism spectrum disorder, speech delays, they respond better when intervened very early and the necessary therapy is done. Next slide, please. So when we talk about development, the very important is the early stimulation which I was talking about. So why early intervention is because we see that the pruning, the synaptogenesis happens at very early age. And we know the concept that if you use it, the development is better. And these synaptic networks, they're lost if they're not used. So use it or lose it. Now, when to start this early stimulation? Start early, as early as possible. And you should set the right time for all the developmental managements. Next. Now, and how to do that? It should be enjoyable to both the children as well as the adult, and it should be developmentally appropriate. Now, who should do? Every child needs it. So the mother is the best person, and the father is also to be included, the whole family, the caretaker. So the onus lies on the whole family. Where and home is the best place. A supportive family really does wonders. Now, for the development, I think physical development is also important. Next, for the journey of nutrition, it all starts early with the breastfeeding. And we all know that
2
every
minutes more,
child...
Dr. Shishalam.
Okay, 2 more minutes?
Yes. You have to
Okay,
wind it up.
so I think I'll not talk more about the breastfeeding, but one thing we have to remember, that breastfeeding for 6 months is important, and exclusive breastfeeding, and continue the breastfeeding up to 2 years with the introduction of the complementary feeds after 6 months, that is 180 days, which provides the age appropriate food. Next slide, please. So regarding the complementary feeds, I think we all know it should be started at 180. Next slide. Next slide. So
Key messages.
I'll not talk about all
Tell us
the
key
complementary
messages.
feeds. Just go ahead. So regarding the stages and regarding the type, the responsive feeding should be and self-feeding should be encouraged, and forced feeding should never be done. Next slide, please. These are all the tips for feeding. Next slide. And for preventing malnutrition and obesity, I think overfeeding is one of the common cause, and processed food and the junk food, what we talk, is another important cause. Undernutrition early is related to stunting. And when I want to talk about stunting, I want to just, next slide, please. So the physical activity is also very important. Even the infants and toddlers do have exercises, including the tummy time, reaching, grasping, crawling, and the unstructured play. They help build strength, coordination, and neurological pathways. Encourage regular active play, and I think the whole family should be involved. Even the father and the mother should be part of the physical activity. Next slide, please. Limiting screen time. Next slide, please. And I said the parents should also be the role models. So we should stop eating the outside food, the junk food, and physical activities, and a good sleep is must. Next slide, please. So, and very, very important as a pediatricians and the caretakers, that whenever they come for the regular checkups, do the growth charts, immunization part, and developmental screenings at a very early age, and track physically and their nutrition. Next slide. Now, why I wanted to talk about stunting was, stunting is, as the WHO definition comes, height for age is more than 2 standard deviation below the WHO child growth standard medians is stunting. Now, why it's important is during the first 2 years of life, if a child is stunted, and he'll be stunted for life. And India is the stunting capital of the world, with over 35.5% of children under 5 years are being stunted. It is very high, above the global average of 22. So it is very important as a pediatrician and caretakers that early first 2 years of life, monitor the growth charts and intervene early so that they don't stunt for life. Next slide, please. Because any other interventions later in life, it's not reversible. So children who are stunted during the golden window often remain stunted for life, impacting both their physical and cognitive abilities. Next.
We need to conclude.
Next. Oh, yeah. So what I would like to say is the golden window period is the most crucial period for the brain development, the physical growth, and the immune system formation. Early interventions during this time have maximum impact and can prevent irreversible damages. After this period, stunting becomes very difficult to reverse and cognitive delays may persist. At the end, I would like to say that any investment during this period has a very great yield, as I said. So let us not see it. Next slide. The take-home messages. Next. So physical activity, think of the early stuntings, the early interventions, the caregivers and the centers who can contribute. Every caregiver and a center can contribute to research and outcomes through active documentation and implementation of evidence-based practices. So a child should not be taken like a thing which can be molded, but we should consider them as a person who can be unfolded. Thank you. Thank you for giving this opportunity.
Thank you for the wonderful talk, Dr. Srisala. Parenting is something we keep on learning as well. Most of us, many of us over here could be into grandparenting as well. Still we are learning. So,
from the IAP Presidential Action Plan,
Maybe
we have the ECD.
minimizing screen time is something which could be added as well, because the biggest problem which I see now amongst children is a lot of screen time. As you said, talking to the children is important between say 1 to 3 years for developing vocabulary, because most of the time in the with the screen they're only listening. There is no two-way communication. So delayed speech is becoming a rampant problem. Every second child comes over कि बोलता नहीं है 2 साल का हो गया 2.5 साल का हो गया. So maybe minimizing screen time is an important thing which should be done.
Screen time not only of the child but also of the
Of the
parents and the
parents. Yes.
grandparents. Because if they are on the
Parents have to
screen,
lead
then-
by example.
Yeah, absolutely.
वो मेरे को पेरेंट्स कहेंगे कि डॉक्टर साहब इसे बोलो कि ये फोन ज्यादा देखता है. मैंने कहा ये पेट से तो देखते हुए नहीं आया फोन. जब उसने देखा होगा मम्मी को या पापा को लगातार फोन पे देखते हुए, then only he would have seen the phone and gone with it. So definitely, ma'am.
Absolutely.
Don't preach, just show them. That's what is a line which I like most about parenting. That children
And maybe-
talk the way you talk. If you talk respectfully to your parents, they talk to you in the same manner. If you talk to others, the manner in which you talk, the children, they just follow. So you just don't have to preach them. You just have to show them.
That's right, Amit. But what happens is many of the times, including the doctors with other patients too, we say, do as I say, don't do as I do. So, that happens many a time. And Sri Sailam, thank you. You have not only told us about the developmental delay, early detection, and early intervention. You have spoken about positive parenting and also mentioned about the negative effects of negative parenting, which is good. And I think parenting is a topic which is very vast. And again, NNF should concentrate on the health education of the public about the effects of good parenting. That is very, very important. With all nucleus family there now, there's no time for that. And the obstetrician should actually involve them very actively during the antenatal periods and include the topics of positive parenting. I like the term, because we had golden minute, golden hour. Now we have golden window. I would suggest that we could say that second 1,000 days of life. So if you have first 1,000 days of life, definitely you will have second 1,000 days of life, which covers 3 years. And that becomes almost 5 years. And 5 years is the period where the children are ready to go to proper school. And with good management of this first 2,000 days of life, I think they will be ready to enter the real world, equipped all the things and to exhibit the true potential and come up in life. So very good. All the 3 talks were fantastic. Thank you, NNF.
Thank you, sir. So with these comments from our chairpersons and excellent talk by all the 3 speakers, can I close the meeting for today?
Dhanyawad.
Since I have answered it.
Dhanyawad.
And one more thing I would like to say is, in the coming years, I would want to see the celebration of not World Health Day, but the celebration of Healthy World Day. I think we should work towards that.
Yes, absolutely. Definitely, sir.
You are a writer, sir, basically.
Thank you very much for that concluding remark. Thank you, everybody.
Thank you, Amit.
And thank you, Neelam ma'am. Thank you, Dr. Ranjan Pejawar. Thank you, Dr. Tejo, Dr. Sri Selam, and Dr. Anupma Reddy. Thank you. And Dr. Manoj, thank you very much for being there. Bye-bye, everybody.
Bye.
Thank you.
Thank you, sir.